week, we will discuss the role of health information technology as a tool to improve the health of populations and communities. We will first define concepts and then discuss how the use of informatics tools can be utilized to work within communities to improve health. As defined by the American Nurses Association, a population includes those living in a specific geographic area or those in a particular group who experience a disproportionate burden of poor health outcomes. One way that population health is addressed is through the Healthy People Project. The initiative's goals are to improve the health of U.S. citizens through specific priorities of health care. The goals and initiatives are measurable and applicable at local, state, and national levels. The website can be searched by topic and includes information that can form the foundations of health and wellness interventions by local groups. A community is a collection of people who interact with one another and whose common interest or characteristic is the basis of that unity. Understanding what is similar and different among those in a community is critical to working with the community to improve health outcomes and well-being. A key to this success is to understand the community's perception of good health outcomes and well-being, since it may be different in each community. Epidemiology is the study of health and disease in defined populations or communities. Statistical analysis of data related to risk factors and disease occurrence can be used by population health professionals to create or revise public health programs that are aimed at reducing epidemics and improving health care of communities and populations. The importance of nurses in informatics and population health can't be emphasized enough. Public health nurses' knowledge and experience is crucial to policy development and to the day-to-day interactions with communities and individuals as they promote health and disease prevention. Nurses need to understand how informatics and communication technology tools can best be implemented in a community to support their health and disease prevention initiatives. Development of strategies to increase the ease of adoption of health information technology tools is another crucial component to the success of informatics in supporting population health. The use of the electronic record in public health supports collection of data into large databases, which enable researchers to have access to large numbers of patients from which to assess the effectiveness of public health initiatives in improving community and population health. Statistics can be used to assess a community or population through the use of information technology. Once data is gathered and analyzed, change of health-related behavior can be as difficult for a community as it is for the individual patient. The first step in any change is to assess the individual or group's readiness to change. The Community Health and Group Evaluation or Change tool is an online resource that can be used to focus assessment and concentrate change efforts in 5 sectors: the community at large, specific community institutions or organizations, healthcare, schools, and work sites. The text describes several examples of public health initiatives that can be implemented in a community. The U.S. Department of Commerce and the Census Bureau maintains the most comprehensive source of demographic data in the United States. Census Bureau maps are interactive maps that enable the retrieval of census data. The American Community Survey is conducted by the Census Bureau each year and samples a small percentage of the population. Federal surveillance programs collect data that provide information for consumers and healthcare providers to help in healthcare decision making. Data related to maternal, child, and adolescent health, infectious diseases, oral health, and chronic disease are maintained in large databases that can be accessed for information that guides planning of population health initiatives. The Center for Disease Control's Behavioral Risk Factor Surveillance System collects self-reported information about medical conditions, alcohol, tobacco, and seatbelt use. The National Health and Nutrition Examination Survey is collected from interview and physical examination findings with a stated objective of understanding the health condition of older Americans. Lastly, The Youth Behavioral Risk Surveillance System focuses on health-related behaviors that are the leading causes of death and disability to our nation's youth. It is administered each year in a paper format to middle and high school students across the United States. Your text describes each of these assessments in more detail. Your text also describes the various programs related to National Vital Statistics System databases. Additionally, many states collect health-related information on hospital admissions, discharges, ambulatory surgeries, and emergency room visits. The Public Health Informatics Institute, developed at Emory University, promotes informatics in improving worldwide health. They worked with the CDC to develop a framework to electronically report cases of sexually transmitted diseases. The spread of communicable disease can have an adverse effect on one's quality of life and the quality of life in a community. For example, in times of man-made or natural disaster, lack of water, food, or proper sanitation can lead to communicable disease outbreaks. Collecting real-time information from a disaster site helps in preparing and responding to the current or to future disasters. Your chapter discusses disaster planning and communicable disease surveillance in more detail. Chronic disease management is another way that informatics tools can be used to improve population health. Your text describes 2 federal agencies who use informatic technologies to impact population health. OSHA is responsible for providing educational programs for community leaders and planners and to emergency workers who respond to natural disasters, biological hazards, or acts of terrorism. FEMA is also well known as a resource of community planning. FEMA provides a framework for communities to frame their emergency preparation plans. In summary, the use of health informatics technology in population health will continue to develop and requires a balance of human and automated inputs to ensure that collected data is accurate and easily available to healthcare providers as they assess and plan for population health improvements.